Hi everyone, it's Heather, and I am finally coming back to do a video about mechanical ventilation. I know it's been a really long time. I've just been working a lot because of short staffing and COVID and all of that. So between school and work, I haven't had a whole lot of free time. So I finally have a few days off in a row, and I thought I would take this opportunity to do a video like an intro to mechanical ventilation. This is just going to go over some of the basic common modes that you're going to see in the hospital when you're at clinicals. Um, and we're not going too in depth. This really is just like a real basic intro about what these modes do. And hopefully you will find it helpful if you are just starting mechanical ventilation or if you kind of are confused about how some of this works. So hope it helps you out. So basically, when you think of a ventilator, it works opposite the way that we naturally breathe. So when we naturally breathe, negative pressure causes the air to go in. So our diaphragm goes down, it expands the space within our chest cavity that causes air to be pulled into our lungs. Okay? So with mechanical ventilation, you are pushing air in. So you're using positive pressure to push air in rather than negative pressure to pull air in. So the three main modes that you might see at the hospital are assist control, SIMV, and pressure support CPAP. They all work the same way in that they are all pushing air into the lungs of the patient. Assist control is basically anytime the machine thinks that the patient needs to take a breath, it pushes a breath in. Anytime the patient starts to take a breath, it pushes a breath in, and it does so to a preset amount. That preset amount can be either volume or pressure. So when you think of that, if you have a balloon, okay, and you have a pressure monitor, like filling up your tire at a pump, and you are pushing air into that tire until the pressure gauge reaches a certain point and then it stops. It's exactly what pressure control mode does. It pushes air in until it reaches a certain pressure within the lungs and then it stops. So the volume that it's pushing in, the amount of air it's pushing in, is going to vary. If someone's lungs are really stiff, if someone's lungs are small, if there's areas that are obstructed, you're not going to get as much volume in because you're going to reach that pressure point before getting in as much volume as you might if a person has healthy lungs that are working well. So if a patient has stiff lungs and they're getting sicker, you can use pressure control to make sure that you're not pushing too much pressure in. Okay, because if we put too much pressure into the lungs, it can cause a pneumo. It can cause the lung to pop, basically, to rupture. And we definitely don't want that. So if we are trying to push in a whole bunch of volume and their pressures are going really high, we need to be careful of that. So that's why we sometimes use pressure control, is to help in those situations where we want to keep a closer eye on the pressure. Volume control is going to push that air into the patient until it reaches a certain volume. So it's going to have a preset amount of air. So if you're filling up your tire at the pump, it's going to say, okay, I want to put this much air into the tire, and it puts that much air in and stops, no matter what the pressure is. Okay. So in volume control, if you're putting in, 450 mLs of volume, it doesn't care what the pressures are within the lungs. The pressures could be 16, the pressures could be 55. It's going to put in that volume. Okay. So volume control is often, at my hospital at least, what a lot of patients are on, unless they get moved to pressure control because we want to keep a closer eye on their pressures. So assist control is going to push that same amount of pressure or that same amount of volume based on whether you have volume control or pressure control. And it's going to do that amount for every single breath, whether it's a breath that's initiated by the ventilator or whether it's a breath that's initiated by the patient. And by initiated, I mean you're going to have a setting for sensitivity, either flow or pressure. And so when the patient starts to take in a breath, the machine's going to recognize that the patient has tried to take a breath, and it is then going to push in that amount of pressure or that amount of volume that you've set on the machine. So that's assist control. Every breath is going to be pushed to the same amount of volume or the same amount of pressure based on volume control or pressure control. So when you look at the machine, it's going to say like ACVC for assist control volume control, or ACPC for assist control pressure control. Okay, so that's one of the more common modes that is seen at my hospital. If you go down into the NICU at my hospital, we are much more likely to see SIMV, which is, I'm going to actually forget what that stands for, intermittent mandatory ventilation, sustained intermittent, SIMV. Okay, basically SIMV is doing the same thing as assist control. It is providing manual breaths to the patient. However, the patient can breathe spontaneously in between the manual breaths, and those spontaneous breaths are going to be whatever the patient does. Okay, so those spontaneous breaths are not going to be pushed to the same volume or pressure as the mandatory breaths. So you're going to have a frequency set on your ventilator. So say you have a frequency of 14 for an adult. 14 of the breaths that patient gets every minute are going to be to the volume or pressure that you have set for that patient. The other breaths in between those 14 that the patient decides to take on their own are going to be whatever volume, whatever pressure that patient takes in. So SIMV allows the patient to take breaths in between that are not pushed to that specific setting that you've put in. SIMV can be done also in volume control or pressure control. So again, you can set either a volume or a pressure for SIMV. So that means the mandatory breaths that the machine gives go to that volume or that pressure. So just again, like putting that air in your tire, you're either looking at a pressure gauge and it's going to go to that pressure, or you're looking at a volume amount and it's going to go to that volume amount. So those are the two modes that are more control modes, okay, because they are giving some mandatory breaths and that are at a set amount. So the other mode you might see, and this is more for patients who are being weaned off of a ventilator, or who are doing a spontaneous breathing trial, something like that. So that would be pressure support CPAP. So just like with wearing a CPAP mask or something like this is a mode that helps give pressure to the patient, helps keep those airways open, helps support that breath, overcoming the resistance of all of that tubing. But it is not giving any preset volume or set pressure per breath to the patient. So it is providing pressure to keep the airways open. It is providing support to overcome all of that tubing and the endotracheal tube, and that breathing through a straw. It's helping the patient to overcome that resistance, but it is not providing volume or pressure per breath. Okay. So on that kind of mode, you're going to be setting your CPAP amount, or you're going to be setting your pressure support amount, which is to overcome that resistance in the tubing. You're going to be setting a PEEP, but you're not going to be setting a frequency. You're not going to be setting a volume. You're not going to be setting a pressure control, a PIP. So you still set FiO2 on all of these modes. You still set pressure support on pressure support CPAP. We use pressure support on SIMV. And those are the three main modes that you're going to see. Assist control, which is giving a set amount of either volume or pressure with every single breath, either either initiated by the ventilator or initiated by the patient. Okay, so assist control can be split into volume or pressure. Then we have SIMV that is also split into volume or pressure, and that gives mandatory breaths and allows the patient to take spontaneous breaths in between. And then we have pressure support CPAP, which is just giving a minimal amount of support, and the patient is doing most of the work of breathing on their own. They're just getting a little bit of extra support to help with that breath. So those are the three basic modes that you're going to see. I will do another video later on, hopefully not too much later, that goes a little bit more into some of the more varied modes that branch off from there, volume control plus PRVC, bi-level, things like that. But so your basic modes: assist control, volume or pressure; SIMV, volume or pressure; and pressure support CPAP. If you have any questions, please ask them in the comments, and I will happily do my best to answer them. All right, everyone, have a good day.